Dr. Juan Magaña grew up in a small suburb outside of Salinas, the son of farm workers. At the age of 13, he was tasked with taking care of his grandfather, this sparking his interest in medicine.
And it wasn't until my grandfather, who moved into our 2-bedroom, 1-bathroom house at the age of 88 years old, who suffered from diabetes, dementia, had a stroke, who would eventually get a leg amputated, eat through his stomach, and required total care.
The process towards becoming a physician took Dr. Magaña 15 years. Now he's back serving his community. His mission, to mentor other aspiring underrepresented minority doctors to do the same.
Having a diverse physician workforce in terms of age, demographic, income, geography, ethnicity, and experiences leads to better care.
About 20% of the United States population and 40% of California's population is Latino. Yet, they make up less than 6% of the physician workforce.
That's a tragedy, and that's unacceptable.
Brenda and Michael are Dr. Magaña's scholars, a part of the Minorities in Medicine program.
I never saw myself within the doctors in my community. So for me, practicing medicine was pretty much something that was unattainable.
Brenda was raised by a single mother who worked in the Salinas Valley fields and only had a 4th grade education.
Someone from Eastside Salinas is able, to not only graduate from college, get a graduate degree, but also go into medical school and practice medicine. It's a great way to inspire the next generation of doctors.
A veteran from Salinas, Michael was inspired to pursue medicine after being treated by medics in the military.
I had a foot surgery and I wasn't really physically capable of doing the job that I had done before. So when I got out, I tried to find another way to serve and to help out the members of my military community.
Serious issues continue to disproportionately plague minority communities, such as mental health challenges, drug abuse, the obesity and diabetes epidemics. Trust in medical professionals often lost.
And for good reasons. The medical community has not been impervious of racism, discrimination, medical experimentation.
The solution to this systemic, generations-old problem, Dr. Magaña says, having diverse people at the table.